Hello, my name is Paola Hernandez, and I'm a senior in the exercise science program, and I am the Lee Health Cardiac Rehab Health Park location intern for the fall 2021 semester. I will be telling you a little bit about what we do here, how it is, and what your responsibility is as an intern. First, we're going to talk about the layout of the room. This is our staff room. This is where the staff comes together for our staff huddle. For any break times, this is where charts are put in. Any office time that is needed will be done in here. Next, we have our exercise floor. This is where the majority of the day is spent. This is where our classes are run. There is two sections to the floor: the cardio floor, which is that inside part with all of our aerobic equipment, and then our resistance training part, which is some machines, some free weights, and some bands. Here is a video of the exercise floor. This picture right here is a sample photo of a pod. It is a treadmill bike combo that will be used by patients that want to use both the treadmill and the bike. That way they don't need to be moving much. If a patient is on the treadmill, no other patient can go on that bike, or vice versa, as it will violate the COVID rules. I'm going to replay this video so we can get a better view of the sorry, I'm not sure what happened. The resistance training floor. Here we have free weights, some bands, and then machines over here. And they're divided by the 140-foot track, which has measurements every 10 foot, every 5 and 10 feet. That will be used for lap walking or the 6-minute walk test. Here is our daily schedule. I arrive between 7:35 and 7:40 in the morning in order to have time to settle in before staff huddle at 7:45 a.m. In the staff huddle, we talk about the classes for the day. We go over the roster, see how many patients there will be, if there are any stagings, evaluations, exits, new patients, or 6-minute walk tests that are going to happen during the class. We also point out if there are any diabetics or any patients with life vests, just so we are aware and can look out for them. There are 7 classes, Monday, Wednesday, and Friday. Each class is 45 minutes of active exercise time, and there is a 30-minute lunch. On Tuesdays and Thursdays, there are only 6 classes, so we stop at the 2:05 class, and instead of the 3:15 class, there is a group orientation for potential new patients. 4 o'clock to 4:15 is our cleanup time, where we make sure that the office is all clean and ready for the next day. Each class will be let in 5 minutes before their start time, so we can begin taking resting vitals and getting patients prepped to start exercising as soon as possible, so they can have the max exercise time possible. And that's our schedule. These are some alterations to schedule. So on Tuesdays and Thursdays, like I said, we only have 6 classes. There is no 3:15 class for the group orientation. Instead, we have office time, and during this time, I will input any charts that need to be input for future patients, calculate med improvements or average blood pressures for upcoming evaluations, or get any other tasks that Mary Kay, my site supervisor, tells me to do. I will get those done during that time. On Wednesdays and Thursdays, so twice a week, we have our education time, and this will be a video and discussion about a cardiac event risk factor and how to lower it. The video will be showed as they are exercising, and then the classes will cool down 10 minutes before so that a staff member can expand upon that topic and really talk to patients about it and get their input on it. Like I said, all classes are admitted 5 minutes prior to the start time. And that is it for alterations to the schedule. Next, we have some basic responsibilities. Before the classes start, I make sure that all monitors that are going to be used have leads. That way patients can easily put them on themselves. All name tags and monitors are put onto chairs. That way patients can find where to sit and are not just meandering along. And I make sure that all equipment and chairs are clean so that patients get the best care. Once the patients are let in, I will greet patients and take any vitals that need to be taken. For patients that do need the monitors, which is patients within their first 13 sessions or that are required to wear it by their insurance, if they have the monitor, we help them put it on, make sure that they have it on correctly and that there is a good read, and then we will get their blood pressure and allow them to start. For patients that are off the monitor, and we'll get their blood pressure and use a pulse ox machine to get their pulse and their oxygen saturation, and then allow them to start. If a patient is a heart failure patient, in addition to the vitals, I will get their weight and ask if they have any increased symptoms of heart failure, which weight would be an indicator of that, if they have any fluid buildup. If they've had any swelling around the abdomen or the legs, that would be a sign, or if they've had increased fatigue or shortness of breath. During the class, we direct patients to their next piece of equipment, let them know their settings, their levels, get them to increase it if they need to. As an exercise physiology intern, you're more or less the go-to person for getting patients started with resistance training and making sure that they're doing that correctly, giving them new exercises, whether it be on the machine with free weights or on the bands. In addition to directing patients on where to go, you will clean machines as patients use them. So again, they can get their very best care. If a patient is within their first 3 exercise sessions, you will take their exercise blood pressure on at least one piece of equipment. Once cool down has been called on non-education days, patients go straight back to their seats, rest a little as we finish cleaning off equipment, and then we will take their blood pressure and pulse ox. Whatever was taken at the beginning will be checked again at the end of the class. If it's an education day, so a Wednesday or a Thursday, cool down is called. Patients go to their seats. We clean off the equipment, and then a staff member, or even myself as the intern, will go up and expand on whatever topic we talked about. If they have any questions, they will direct them to us as we finish our presentation, and then we will take their vitals again. At the end of that day, so around that 4 o'clock time, we will make sure that all chairs are clean. All of the blood pressure cuffs have been cleaned. All of the monitors that were used were put away, and all of the pulse oximeters were put away. That way we can have a nice, tidy work area for the next day as we begin it. Next, we have initial evaluations. Our role as an exercise physiologist during an IE is really to determine where they are in their stages of preparation for exercise. Typically, if a patient has set up an IE, they are in the preparation/action portion. During it, we will also determine a target heart rate and MET range, and an initial exercise goal. There is a couple parts to an IE. First, we will introduce ourselves to the patient, which is really important in order to establish a rapport with them and make the rest of the time easier. We will get their patient history and current exercise status from the nurse that has been working with them. And this current exercise status will allow us to determine that initial exercise goal, which is going to be used until their 30-day evaluation, which their case manager will create a new goal based off of how well they did with the last goal and how they have done in the program. There are 2 functional assessments done, the timed up and go test and the 6-minute walk test, and I will cover more about this in our sample introduction to a patient video. Once the patient interaction part of the IE is completed, we will put in the information into the computer, calculate that target heart rate range and that MET range using the 6-minute walk test data, and make their name tag, which will give us obviously the patient's name, their ranges, what their diagnosis was, when their procedure was, and any signs or symptoms that they had, so we can watch out for those. These are the materials needed for an IE. We have the instruction sheet, which I will go over in the next video. The stopwatch is needed for both tests. The blood pressure cuff and the pulse ox are required for the end of the 6-minute walk test, as we see that we need it for the post data. And then this sheet is where we will calculate the laps. We will keep track of the laps completed, which will help us calculate the distance, how fast they walked, and what their METs was. In this paper, we will also note if they had any assistive devices, i.e. a cane or a walker, and what their tug test was, which will both help us know if a patient is a fall risk. Here is an introduction to patient sample.
Hi, my name is Paola Hernandez. I'm the exercise physiology intern here at Lee Health Cardiac Rehab. I'm going to be taking you through 2 functional assessments today, the 6-minute walk test and the timed up and go test. We're going to do the timed up and go test first, and for that I'm just going to have you sit in a chair, stand up, walk 10 feet, turn around, and sit back down. And then we're going to do the 6-minute walk test, and for that I will use some instructions right now. The object of this test is to walk as far as possible for 6 minutes. You will walk around the brown track that will be shown in the next video. 6 minutes is a long time to walk, so you may be exerting yourself. You may get out of breath or become exhausted. You are permitted to slow down, stop, and rest as necessary. You may lean against the wall or on a chair while resting, but resume walking as soon as you're able. I will be keeping track of the number of laps you complete and making sure that you are okay as you go. Are you ready? All right.
And here we have a sample of the 6-minute walk test.
Your time begins now.
So for this test, we always let patients know when they can go, and then we alert the class that is going on that we have started a 6-minute walk test in order for them to be careful of the track so that nobody gets in the patient's way as they are completing the track. As they go through it, we always make sure that we are alerting them of their progress, how much time has been done, how many laps they have completed, how much is left, and we make sure that they are doing okay as they go. Lee Health Cardiac Rehab Health Park is a fantastic location. I hope this helped you learn a little bit about what it is to be an intern there, and I cannot give enough praise on how much I have learned throughout this time and how wonderful the staff truly is. It is a fantastic location, and you would do wonderful being there. Thank you very much.